What are the contraindications for testosterone therapy? So for men, the main contraindication for TRT is active prostate cancer. Now, if you have a history of prostate cancer and it's been treated definitively, TRT is not contraindicated, meaning that you can take it as long as you don't have active cancer. For women, you don't want to give testosterone to anyone who's trying to conceive or currently pregnant or breastfeeding, or anyone who already has high androgen levels. Like if you have polycystic ovarian syndrome, you probably don't need more testosterone. Interestingly, although most oncologists will recommend against testosterone or any hormones if you have breast cancer, there are studies that show that testosterone is actually anti-breast cancer. So if you have a history of breast cancer and you want testosterone, you might talk to your doctor about that. All right, what about dosing? So typical dosing for TRT in men starts at about 100 milligrams per week intramuscularly injected and about 100 milligrams per day if you're doing a transdermal cream. For women, we tend to use about a tenth of the dose we use for men, although this is pretty variable because everyone responds differently. Classically, with men, we use these big intramuscular needles and we would inject it 1 to 2 times a week. Ouch. I am more a fan of dividing out that weekly dose into smaller doses and then giving it subcutaneously with an insulin needle more frequently, like every day or every other day. And you can do this in both men and women. The smaller needle is less painful than that big ass intramuscular needle. If this was helpful, follow along for more hot tips and major revelations.